Tonight, many, including doctors, raising questions about President Trump's decision to go for a ride. He left his sickbed so he could greet his supporters outside the hospital where he's being treated for COVID-19. One doctor called it insanity. Government Affairs reporter Melissa Russo has the latest on the controversial joyride. Melissa, the White House continues to defend the president's actions.
Gilma, the White House is insisting tonight that the Walter Reed medical team treating the president cleared the decision for President Trump, contagious with active COVID, to step out of quarantine today and into an SUV with the Secret Service so that he could wave to supporters outside the hospital.
Mr. President!
It came as quite a surprise this afternoon when the Secret Service motorcade suddenly appeared carrying the COVID patient in chief.
God bless our president! I will die for him!
President Trump tweeted a video a minute before he took the ride.
I also think we're going to pay a little surprise to some of the great patriots that we have out on the street.
Trump supporters were thrilled, but some doctors were appalled.
There's no doctor that would say now is the time for a joyride around the hospital. He should remain put. He should remain in isolation.
A major concern, the safety of the president's security detail with him inside that SUV. The Secret Service tonight telling NBC we don't comment on protective operations. Dr. James Phillips, an attending physician at Walter Reed Hospital where the president is staying, tweeted tonight, every single person in the vehicle during that completely unnecessary presidential drive-by now has to be quarantined for 14 days. They might get sick. They might die for political theater. White House spokeswoman Kayleigh McEnany on Fox News tonight.
And he said he's feeling really good, really strong, wanted to thank his supporters. I spoke with the president yesterday, and he was his typical self, hard at work, dictating a statement, remarks to me, and very meticulous about the precise wording.
The president appearing well and wanting to show it before returning to the hospital for at least one more night. Later, releasing pictures of himself working there tonight. Earlier today, Trump's doctor admitted they initially withheld the president's high fever and dropping oxygen levels, which they claim now have improved.
I didn't want to give any information that might steer the course of illness in another direction, and in doing so, it came off that we were trying to hide something, which wasn't necessarily true.
The medical team is still not sharing information about whether Trump's chest scans show lung damage or pneumonia. It's worth noting that yesterday the White House told NBC the reason First Lady Melania Trump had not visited her husband in the hospital, quote, she has COVID. That would expose the agents who would drive her there and the medical staff who would walk her up to him.
A president clearly eager to get back in front of his fans, but who will have to avoid the campaign trail until he is no longer contagious. He is not considered medically out of the woods yet, though his doctors did say today that the president could go home to the White House tomorrow, possibly. A new National Wall Street Journal NBC News poll, meanwhile, conducted after last Tuesday's debate, but before Trump's diagnosis on Thursday, showed Joe Biden ahead by 14 points. Gilma.
All right, Melissa, thank you. Efforts to contact donors who attended a Trump campaign fundraiser in Bedminster, New Jersey continue. The White House provided the New Jersey Department of Health the names of some 206 people who were at the Thursday evening event at Trump National Golf Course. The president announced he had tested positive for COVID after attending that event. The DOH is recommending that guests self-monitor and quarantine if they were in close contact with the president and his staff. Golf club staff members, meantime, will be interviewed by the county's Department of Health. Former New Jersey Governor Christie is still in the hospital a day after testing positive for coronavirus. Christie, who has a history of asthma, checked himself into Morristown Medical Center. His asthma and his weight put him at an elevated risk of developing COVID complications. The former governor says that he feels good and is suffering only mild symptoms.